Hi, I'm Dr. Frank Jevnikar. I'm a private practice urologist with Siminovich and Associates. I've been practicing in Lake County and with Lake Health for 15 years. The prostate is a gland that is responsible for fluid with ejaculation, so it is a reproductive gland. It sits at the base of the bladder, and as men get older, for most men, their prostate will naturally grow. Unfortunately, for some men, that growth will lead to blockage with the way that the bladder empties itself. Prostate health is important because there are certain medications and diets which can reduce your likelihood for developing either prostate cancer or complications related to benign prostatic hypertrophy. Some diets that are high in fish, low in red meat and animal fats, high in lycopenes, which are found in cooked tomatoes or chickpeas, or a variety of legumes which are similar to beans and peas, will also keep your prostate from growing and may have a protective benefit for prostate cancer. We recommend prostate screenings, specifically prostate cancer screenings, begin for most men at the age of 50. For men with primary relatives who have prostate cancer, and that would be a brother or father who has been diagnosed with prostate cancer, for those men, they should have their prostate screenings begin at age 40. The overall question is, what is the overall lifespan or health of the patient? And this should be a shared decision between the patient and the physician. So patients that have other medical problems that may prevent them from living 10 to 15 years may decide that prostate cancer screening would not benefit them. Typically those are men in the 70 to 80 year range, and as of 80, we usually pull back on how intensively we're screening men. Typical symptoms that men will experience because of an enlarged prostate would be urinary frequency, a feeling like their bladder isn't completely emptying, waking more often at night than the patient seems is reasonable. In other words, if somebody's drinking a lot of beverages before they go to bed, we would expect them to wake 1, 2, maybe 3 times a night. But somebody who is managing their fluid intake in the evening hours and is still waking an excessive number of times is now having issues that affect their quality of life because their quality of sleep has been affected. Those would all be reasons to see a doctor and have a discussion about their prostate.